The U.S. Supreme Court has blocked the Biden administration's vaccine mandate for companies with 100 or more employees. Good evening and thanks for joining us for the 10 o'clock news. I'm Marcella Lee.
And I'm Jesse Pagan. The court's conservative majority ruled the administration overstepped its authority by requiring workers to get vaccinated against COVID or get tested weekly. However, the ruling does not ban companies from enforcing their own vaccine and testing requirements if they choose to do so.
And this does not apply to public employees, including San Diego police officers and firefighters. Jim Cunningham represents the San Diego Firefighters Union and county employees.
I can tell Mayor Todd Gloria, Supervisor Nathan Fletcher, and Governor Newsom that their mandates that are in place are still legal and still enforceable.
But the justices had another big decision to make as well. In a separate ruling today, the Supreme Court upheld the COVID vaccine mandate for healthcare workers who work in facilities that get federal funding.
CBS 8's Richard Allen investigates how this decision impacts California's healthcare force and talks with one longtime nurse who just quit in response to the mandate.
Well, that's right. This ruling impacts 17 million healthcare workers at 76,000 medical facilities throughout the country, according to the White House, including hospitals and healthcare clinics throughout San Diego County. Under this 5-4 decision, the Biden administration proved victorious in requiring the COVID vaccine for healthcare workers employed at facilities that receive federal dollars through Medicare and Medicaid.
CMS's requirement for healthcare workers to be vaccinated will save the lives of patients, as well as the lives of doctors, nurses, and others who work in healthcare settings.
Legal analyst Dan Eaton points out that this decision on the federal level does not impact the statewide mandate already in effect, requiring healthcare workers in California be vaccinated against coronavirus and to get their booster by February 1st.
This ruling doesn't affect that. It reinforces it, I suppose, because receipt of federal funds is now conditioned on getting vaccinated. But they're going to have to get vaccinated or they're going to have to get another line of work.
I was definitely disappointed.
San Diegan and registered nurse Jess McKee has worked in healthcare for the past 21 years. She resigned from her hospital on Thursday after refusing to get the now mandated booster shot, after she says she suffered ongoing cardiac problems following her first 2 vaccine doses.
I couldn't continue on and I couldn't comply with a third booster. And I didn't feel like I needed to do an exemption for that.
McKee believes it's not right to require the COVID vaccine on either the state or federal level.
No one should be mandating what you're going to be putting into someone else's body.
When it comes to patient safety, McKee points to new guidance from the California Health Department, which she calls contradictory, allowing COVID-positive healthcare workers who are asymptomatic to continue working with patients.
Because they've created such a massive shortage and now they're mandating something to make the shortage even worse. I mean, it's just, exacerbating everything.
And this federal mandate does not include a testing option for unvaccinated workers, but does include medical and religious exemptions.